A granulocyte do not have any granules like monocyte, B and T lymphocytes, and then there are granulocytes which are neutrophil, eosinophil and basophil. Eosinophil was formed with interleukin 5, basophil was formed while interleukin 3, and then the precursor of neutrophil is myeloblast cell. So stage of leukopoiesis. Pre-T cell, T and B cell. Lymphoid from pre-T and pre-B cell, which form B and T cell. Now, colony forming unit, granulocyte, monocyte. Granulocyte and monocyte. Granulocyte form myeloblast, promyelocyte, myelocyte, metamyelocene, neutrophil. Whereas eosinophil form eosinophil, myeloblast, promyeloblast, promyelocyte, metamyelocene, eosinophil. Basophil, myeloblast, basophil, promyelocyte, metamyelocene, basophil. Then it was monoblast, promonocyte, monocyte, macrophage and reticulocyte. So our colony forming unit gene is basically responsible for blast, then site, procyte, meta, this monoblast, monocyte. So it's very similar as we did in RBC formation. Now this is important for your practical point of view. Neutrophil are most prevalent leukocyte in blood. Acute pyogenic infections are fought off using neutrophil. Arnett count. Presence of younger neutrophil indicates stimulation of bone marrow, and of older cell suppression of bone marrow. Hypersegmented nucleus or typical megaloblastic occur to 4 neurotoxins. Neutrophil granules are of four types: primary, secondary, tertiary, and secretory granules. Primary, secondary, tertiary, and secretory. Increased neutrophil count is called neutrophilia, neutropenia. Acute neutrophil increases in exercise, cold, emotional stimuli, stress, panic, depression, infections, drugs, chronic inflammation, pancreatitis, and infections like typhoid. In typhoid, neutropenia occurs. Increased neutrophil destruction. Neutropenia can be due to decreased production or increased destruction. Increased destruction occurs in malaria, Kala Azar, whereas decreased neutrophil production occurs in infections like typhoid and aplastic anemia. Hypersplenism. Spleen destroys the So if someone asks you what's the condition called as when neutrophil increases or decreases, you say neutrophilia, neutropenia. What are the pathological and physiological conditions when neutrophilia occurs? So pathological is going to be excessive exercise, then stress, then depression, excitement, then pathological can be due to inflammation of pancreatitis, or due to infections, acute bacterial infections, and physiological can also consist of exercise, cold, surgery, pain, labor. And then neutropenia occurs because there can be increased destruction or decreased neutrophil production. Decreased neutrophil production is due to aplastic anemia, drugs, infections like typhoid, then encourage neutrophil destruction like in Kala Azar, malaria, hypersplenism, etc. and viral disease like measles and influenza. There is increased neutrophil destruction. Now neutrophil has two pools, tissue pool and marginated pool. In marginated pool it adheres to the endothelial tissue, endothelium. It's called margination, whereas in tissue pool content tissue, the blood and all. So what are chemotaxis? It is the migration of neutrophil to the site of infection. This occurs due to chemoattractants or chemotactic factors released by the infection site of infection. Chemotaxins give signal to neutrophil to come and kill me. And there is diapedesis, which is the squeezing of the neutrophil through the space between endothelial cells. Eosinophil usually go for allergy and live longer in tissue. Cytokines are produced. Eosin produces interleukins, which are responsible for inflammation due to allergy. Granulocytes, eosinophil, have granules, coarse, brick red, nucleus is bilobed. Major basic protein. Major basic protein is toxic product of eosinophil. It is used against intestinal parasites. What is used against intestinal parasites is eosinophil, bitch. What are types of parasites? It can be hookworm, roundworm, Wuchereria bancrofti, and stuff like that. Anaphylaxis. Bronchial hyperactivity is related to eosinophil. Glucocorticoids are given. Eosinophilia, eosinopenia. If someone asks you what's the condition when eosinophil increases and eosinophil decreases, eosinophilia, eosinopenia. Eosinophilia occurs in helminthic infections like Ascariasis, Wuchereria bancrofti. Then there is roundworm, hookworm, encyclotomiasis, right? And then allergic reaction diseases like bronchial asthma, hay fever, allergic rhinitis or dermatitis, allergic rhinitis, allergic rhinitis, and allergic and atopic dermatitis. Then drug reaction, then eosinopenia, aplastic anemia, glucocorticoid therapy. It decreases, the glucocorticoid therapy eosinophil decreases, and allergy or inflammation due to eosinophil also decreases. So it's 2 to 4% in the blood. Its size is similar to that of neutrophil. To 14 micrometer. Basophil is smaller than eosinophil and neutrophil. It has the same diameter as 10 to 14. Eosinophil, basophil and neutrophil have sort of same diameter, 10 to 14 micrometer. This is S-shaped, whereas our eosinophil was bilobed. Right. Now it has dense porous blue granules which consist of Charcot-Leyden crystal. Cytoplasm contains glycogen deposits, free ribosome-free liquid bodies. These basophil granules secrete histamine, chondroitin sulfate, and many other leukotrienes and major basic protein. Mast cells, whereas mast cells secrete histamine, heparin. Massive release of histamine produces immediate hypersensitivity reactions such as anaphylaxis, hypertension, causes vasodilation. Basophil are more in chronic allergy conditions such as asthma. growth factors of basophil mast cell. So what do we know about basophil? Basophil size is around that of neutrophil, 10 to 12 micrometer, and basophil is responsible for allergic reaction. Basophil is also responsible, let's say, more responsible for the allergic reaction as compared to eosinophil. Eosinophil are more responsible for the removal of the parasites, all the roundworm, hookworm, or Wuchereria bancrofti, causing filariasis, right? So in Addison's disease too, and eosinophil eosinophilia is present where less cortisol is produced. Now we know that eosinophil decreases, eosinopenia occurs in glucocorticoid therapy. But when glucocorticoids increase, that condition is called Cushing syndrome. And when they decrease, it's called Addison syndrome. Okay, so remember that. So yeah, now basophil and mast cells. So it has S-shaped nucleus, it has blue granulocytes containing Charcot-Leyden crystals, and these basophil granules are responsible for secreting histamine, chondroitin sulfate, tryptase, carboxypeptidase, capsaicin. Whereas mast cells are responsible for releasing both histamine and heparin. Both of them are responsible. Now IgE is responsible for allergic shit. So IgE binds to membrane of these cells and initiates degranulation. This leads to the release of histamine. Massive release of histamine initiate anaphylaxia. So role in chronic allergic reaction, role in T-cell dependent. So then let's come to basophilia and basophilia. Basophilia occurs in allergic reaction, rhinitis, then arthritis, infections like influenza, neutrophils decrease in influenza, basophil increase in influenza. Basophil increase in influenza and neutrophil decrease in influenza. Okay, so basophil also increases in iron deficiency, polycythemia. Basopenia occurs in Cushing syndrome, eosinopenia also occurs in Cushing syndrome, and so does basopenia. Cortisol therapy is given, same glucocorticoid therapy. Yeah. Now let's talk about parasite. Monocytes are largest blood cells. Identifying feature, they are 12 to 25 micrometer. The cytoplasmic nuclear ratio is 50:50. The nucleus is kidney shaped, it may be horseshoe shaped or irregular. Characteristic is homogeneous. Phagocytosis microbial killing. Monocytes are responsible for phagocytosis microbial killing and antigen presenting cell. Monocyte count. Monocytopenia occurs in aplastic anemia. Monocytosis occurs in increase in monocyte is called monocytosis, whereas decrease in monocytopenia. It decreases in aplastic anemia, leukemia, whereas hairy cell leukemia, monocytosis increase in monocyte occurs in acute monocytic leukemia, Hodgkin's disease, malaria, kala azar. Neutrophil decrease in malarium kala azar, while monocytes increase in malarium kala azar. We studied that in Cushing syndrome, eosinopenia and basopenia occurs, and malaria and kala azar, monocyte increase and neutrophil decreases. Glucocorticoid therapy, it increases, whereas basophilia and eosinophilia decreases. Macrophages form mononuclear phagocyte system, Kupffer cell in liver, then osteoclasts in bone marrow, then microglia in brain, mesangial cells in kidney. Lymphocytes are heterogeneous groups of cells. Small lymphocyte, same size that of red cells. Identifying features, you think is 6 to 9 micrometer. Ovoid or kidney shaped nucleus, but densely packed. Thin bluish film does not contain granule. Cells are 10 to 15 micrometer, 9 micro, 10 micro. Over the eccentric. Flavor green kind, usually 3% of light and pink. Lymphocytopenia. Increase in lymphocytes called lymphocytosis. Lymphocytopenia.